Hello, my name is Elise Scora, and I'm the Clinical Director with NYSTART Region 5.
And I'm Dr. Andrew Kent, and I'm the Medical Director of Region 5.
And today, Andy and I are going to review some common medical conditions and some systemic reviews that will be really helpful for you all to be aware of as you're working with the individuals. So to start, throughout this training, Dr. Kent and I will discuss several common medical conditions that we all encounter when working with people with intellectual and developmental disabilities. All of these conditions are incredibly important to evaluate and investigate when working with an individual. Before even examining the psychological or social influences, you always want to investigate the biological influences first. Imagine individuals having focal seizures that are being missed, causing aggression and emotional disturbances, yet they are instead being treated by antipsychotics rather than their seizures being understood and treating appropriately. Or someone having an allergy or digestive concern, and rather it's being seen as a mental health issue. To understand the individual's present medical conditions and possible influences, you should always gain historical medical records and any prior assessments to understand the conditions. It's also important to recognize that many conditions and diseases have a higher prevalence in the IDD population. But research also indicates that there's a high number of undiagnosed medical conditions in the population. Some research indicates as high as 75% of individuals with IDD having at least one undiagnosed medical concern. There are a number of factors that contribute to these undiagnosed situations, but it's incredibly important to be aware of this and to ask questions and investigate the biological symptoms early. To start, I'm going to talk about diabetes. So diabetes is a disease in which the person's blood glucose or blood sugar levels are too high. Glucose comes from the foods that are eaten. Insulin is a hormone that helps the glucose get into the cells to give them energy. Individuals may be diagnosed with prediabetes, type 1 diabetes, or type 2 diabetes. Prediabetes simply means that the individual's blood sugar is high, but not high enough yet. The system should be monitoring this condition closely as it could quickly become diabetes type 2. At times, individuals may be on medication to regulate to avoid it developing further, or a diet may be recommended. In type 1 diabetes, the body does not make insulin. This is also known as juvenile diabetes. People with type 1 diabetes are insulin dependent, which means they must take artificial insulin daily to stay alive. In type 2 diabetes, the more common type, the body does not make or use insulin well. Type 2 diabetes has a strong link to obesity. Over time, having too much glucose in your blood can cause some serious problems. It can damage your eyes, your kidneys, and your nerves. It can also cause heart disease, stroke, and even affect the limbs. Blood tests are used to determine if someone has diabetes. Other tests, such as the A1C, can check on how well the diabetes is being managed. It's very important to understand the changes in a person's blood sugar levels and how it can affect a person's mood and mental status. Fluctuations in blood glucose can result in rapid mood changes, including low mood and irritability. Poor management of blood glucose can lead to negative moods and a lower quality of life. Since it is possible that the individuals we support may not be able to tell us or recognize if their blood glucose is too high or too low, it's important to investigate if this is playing a role in their presentation. Someone with low blood glucose may feel confused, hungry, jittery, irritable, tired, or sweaty. Someone with high blood glucose may feel tense, angry, sad, faint, thirsty, tired, nervous, or lethargic. You should ensure the individual is checking their blood sugar regularly, following their diabetes management plan, and if there are concerns regarding management of the diabetes leading to behavioral health symptoms, ensure this is being discussed with their provider.
The genital urinary system is very connected to mental health. It's not unusual for people to talk about premenstrual dysphoria. It's also not uncommon for a woman going through her menses to have pain impact her emotional state, as pain could for any individual. There are a few specific things, though, that I want to point out that may be a little less obvious. If a woman is having abdominal pain and seems to be splinting, which is a body position where they seem kind of guarded and don't want to be moved or don't want to be touched, there are certain things that can cause this. An ovarian cyst is an example. This is very common in polycystic ovarian syndrome, which we see in our individuals. Endometriosis can be another cause. This is where there's abnormal uterine tissue growth in the uterus or areas that are adjoining it. Precocious puberty is also something to bring up. It can be painful and lead to menstrual cramps in somebody younger than we would expect to be actually having their period. According to some research that I've read, there is a correlation between precocious puberty and Down syndrome. Now, men are not left out of this slide either. Prostatitis, something to discuss. It's an inflammation of the prostate. It's associated with urinary frequency and an urgency to go. Now, you may have an individual trying to make their way to the bathroom excessively or constantly asking to go. This can be perceived improperly as a manipulation or an annoying behavior, but in fact, if they have that, they really can't help it. Epididymitis is an infection of the cord that attaches to the testicle, and this can be super painful for a male individual. Torsion is when it actually twists on itself, and that, in fact, is a medical emergency. This would be recognizable as the area is swollen, painful, and warm to touch. A couple other things, hydrocele and varicocele, those are swellings. The former is a fluid-filled sac around the testicle. It's usually noticed as a little bit of swelling in the scrotum. It's very often benign in a child and it goes away. In older men, however, it could develop due to injury. If it gets big enough, it could be painful and need to be removed. And lastly, varicocele is when the vein gets swollen and enlarged because of poor drainage. This could be due to the valves not working properly or being compressed by a structure next to it. This too can become painful and big enough that it may need to be treated. And one last point on that, it can also lead to infertility problems. Okay, dental. Dental pain and dental maladies are very common in the general population. With good hygiene and proper care, for most people, problems can be treated early and there is a prevention of greater harm. The challenge in our population that we serve is that the social communication is off and we may not know what's occurring and what they're actually experiencing. If we see someone who's irritable, angry, and lashing out, think about the dental issues. Are they holding their face? Are they grimacing or maybe showing some new facial tics? Are they struggling to eat things that they would normally like? Is there a smell to their breath that didn't exist before? A good dental exam will help rule out cavities and abscesses. Wisdom teeth are also a fairly common problem. Once again, easy enough to find out on a good dental exam with x-rays. This, of course, is not taking into account that in some of our individuals, it may not be easy to get them into a dental chair and sit still for x-rays. They may need sedation, but it's often necessary if they are in fact experiencing such pain. Now, TMJ, temporomandibular joint pain, that's a very real phenomena where there is pain in the jaw where it attaches to the skull. This can be worsened by anxiety and it can be caused by a blow to the face or head in that area. It can come and go and be exacerbated by eating things that are hard or difficult to chew. And the pain from TMJ can radiate down towards the chin or in towards the ear and essentially mimic an ear infection. It can be very tender to touch, and it's also something else to consider. Lastly, dry mouth is something to think about. It sounds fairly benign when we compare it to all the other things we're talking about, but it could be not only annoying, it can lead to cavities and infection. The other reason I leave it on the list here is because many of the medications we use create dry mouth in the first place. So if we suspect this, we want to make sure the individuals we serve are getting water breaks, have dietetic candies, or commercially available treatments, and also are encouraged to have adequate brushing habits. The dry mouth definitely places that person at a higher risk for cavities.
Okay, so to move on to the neurological system, a very important one for us to discuss for this population. So neurological disorders are diseases of the central and peripheral nervous system. This includes the brain, the spinal cord, the cranial nerves, the peripheral nerves, the nerve roots, the autonomic nervous system, and the neuromuscular junction and muscles. Disorders in the neurological system include epilepsy, Alzheimer's disease or other dementias, strokes, migraines or other headaches, multiple sclerosis, Parkinson's disease, brain tumors and cysts, and traumatic disorders, including TBI, among others. For the purpose of this training, I'm going to focus on epilepsy and migraines and other headache disorders. Starting with epilepsy. Epilepsy is a disorder of the brain. People diagnosed with epilepsy have had 2 or more seizures. There are multiple impacts of epilepsy. Psychologically, the cognitive activity is affected by the underlying brain pathology, by the effects of repeated interruptions in consciousness, and by anti-epileptic drugs. All of this tends to reduce cognitive function. This may lead to sedation, poor motivation, or be expressed as irritability, impulsivity, or disinhibition. Repeated disruption of consciousness interrupts memory and learning. It's important to know that psychological disturbance may occur before, during, or after a seizure. The prevalence of epilepsy co-occurring in the ID population is 22%, compared to 1.8% of the general population. The ID population are also more likely to have communication deficits, which make treatment more difficult. They also tend to have more behavioral health symptoms, which overlap and cause difficulty. It can also be difficult to engage individuals with ID in the testing that is required for epilepsy. The EEGs can be uncomfortable and induce reactions related to sensory concerns, or they can be more fearful and not understand the process of an MRI. 30 to 40% of the ID population with epilepsy are also treatment resistant in relation to their seizures. Approximately 1 in 4 children with epilepsy will have significant behavioral challenges. Another 1 in 4 children will have emotional difficulties, which may be less severe, but still concerning. In general, behavioral problems are more troublesome in children whose seizures begin at an early age. This is especially true for boys, who are more likely to, quote unquote, act out, but girls are also affected. Their emotional problems may be recognized less often. Behavioral difficulties can be caused or worsened by epilepsy. Several aspects of epilepsy can affect the brain and contribute to behavioral problems, such as underlying brain damage, the seizures themselves, the small electrical discharges between the seizures, and the effects of seizure medicines. Any of these can impair normal brain functions or may cause chemical imbalances in the brain that lead to psychiatric difficulties. In some cases, small effects accumulate over many years and cause psychiatric problems to emerge in adulthood. You may see brief periods of abnormal behavior leading up to a seizure, during a seizure, or for a few days after a seizure. When working with the IDD population, it's incredibly important to ensure their seizure disorder is properly managed. As discussed, the seizure disorder could be related to any behavioral health symptoms they have concerning to the system. Moving to migraines and other headaches, which is another area that I want to discuss. Headache disorders are among the most common disorders of the nervous system. It's been estimated that almost half of the adult population have had a headache at least once within the last year. Headaches itself are painful, they're disabling, and it's a feature of a small number of primary headache disorders, namely migraines, tension-type headaches, or cluster headaches. Migraines are a primary headache disorder, often beginning at puberty, and mostly affects people between the ages of 35 and 45 years old. It's caused by the activation of a mechanism deep in the brain that leads to the release of pain-producing inflammatory substances around the nerves and the blood vessels in the head. Migraines are recurrent and often lifelong. Attacks typically include a headache which is of moderate to severe intensity, one side of the brain, pulsating in quality, aggravated by routine physical activity, a duration of 2 to 3 days, up to 2 to 3 days, and could be paired with nausea, people vomit, they might lose their vision, or it might get spotty, dizziness, etc. Cluster headaches is another primary headache disorder. It is less common, but it's characterized by frequent recurring brief but extremely severe headaches, usually focused in or around one eye, with tearing and redness of the eye. The nose runs or is blocked on the affected side, and the eyelid may droop. Cluster headaches have both episodic and chronic forms. Tension headaches are the most common primary headache disorder. It has both episodic and chronic forms as well. The headache may be stress-related or associated with a musculoskeletal problem in the neck. The headache is described as pressure or tightness, often like a band around the head, sometimes spreading into or from the neck. As discussed, these headaches at any time can be really impactful to an individual, and if they can't communicate their pain, it's really important that this is investigated if you feel that any neurological problems are part of their presentation. To move on to gastrointestinal. So the gastrointestinal system refers to diseases and conditions involving the gastrointestinal tract. specifically the esophagus, stomach, small intestine, large intestine, and the rectum, and the accessory organs of digestion, including the liver, gallbladder, and pancreas. A few conditions that are of view that affect the IDD population are constipation, irritable bowel syndrome, reflux, and celiac. Constipation, which it means it's hard to pass a bowel movement. They may be infrequent, less than 3 times a week, or incomplete, usually caused by inadequate fiber in the diet or psychotropic medications. It causes a person to strain during a bowel movement. It may cause small hard stools and sometimes anal problems such as fissures or hemorrhoids. IBS, or irritable bowel syndrome, is a condition in which the colon muscle contracts more often than in people without IBS. Certain foods, medicine, and emotional stress are some factors that can trigger IBS. Reflux is a burning pain or discomfort in the upper chest and mid-chest, possibly involving the neck and throat, and they may worsen when lying down. Digestive disease in which stomach acid or bile irritates the food pipe lining. And celiac is something that is an immune reaction to eating gluten, a protein found in wheat, barley, and rye. Over time, the reaction creates inflammation that damages the small intestine's lining, leading to medical complications. It also prevents the absorption of nutrients. Gastrointestinal concerns are really important to investigate. Going as an example, reflux, the person might be irritable, they might be aggressive even, they might avoid laying down, going to bed, and we might be treating them more with psychotropic medications. Maybe they're anxious, maybe they're depressed, but maybe when they lie down, this reflux is getting a lot worse and that's impacting their sleep, so they avoid that action. So really investigating the medical side of things, specifically with gastrointestinal, could alleviate some of those problem behaviors that systems are reporting.
So the thyroid gland, which is located in the neck, is important to discuss. It's truly essential and has far-reaching impacts upon so many areas of the body. It's regulated by the pituitary gland, which tells it to make more or make less, depending on what's needed. Graves' disease is one of the most common autoimmune causes of hyperthyroidism. What this means is there's too much thyroid hormone being made. Now, interestingly, if you look at common symptoms of this, they're anxiety and irritability, which shows that we certainly need to be on the lookout for this when we see behavioral health symptoms. With hyperthyroidism, one also sees a fine tremor of the hands or fingers, a tendency to be heat sensitive and feel warm or perspire more than usual. You might see weight loss even though the person tells you they're eating normally. You could see the thyroid become enlarged a little bit and form what's called a goiter. There could be a change in menstrual cycle as well as a change in sexual functioning. You can see an increased frequency of bowel movements, tiredness, reddening of the skin, heart palpitations, and sleep disturbance. Generally, the whole system is revved up and not feeling well. And one last thing about this is the most classic sign that people may think of or have seen is when the eyeballs seem like they're bulging out. That, in fact, can be a sign of Graves' and hyperthyroidism, but it's a later stage sign. So you sure as heck want to catch it before then, not just for cosmetic appearance, but the fact that that could actually damage your eyesight. Also on this slide, I mentioned thyroiditis, which simply just means an inflammation of the thyroid. In addition to autoimmune inflammation, such as Graves', you can get infectious thyroiditis, which means that unless you treat the infection, you're going to see those symptoms. Medication can also play a role. Certain medications can cause the thyroid to hyperfunction, and other medications can cause a decrease in functioning. Even excess iodine, although not as common an issue, can have an impact if someone eats an excessive amount of seafood or takes an excessive amount of supplements that have a lot of iodine. Likewise, an iodine deficiency can do the opposite and lead to underproduction. Now, hypothyroidism is, of course, underfunctioning of thyroid. And I want to mention the most common one, Hashimoto's, because it's very interesting because it actually can cycle. People with Hashimoto's can see a flare-up of hyperthyroidism and present in that fashion, and then have a drastic reduction. So they really need to stay on top of it and keep their thyroid replacement hormone adjusted properly. Many of these people eventually will burn out and then will need a steady state of thyroid replacement and be fine. But until they get there, they could be somewhat baffling to the physician because it could look too high and then look too low at other times. In addition, on this slide, I want to mention that medication can have an impact, in particular lithium, because many of our individuals are on that. One has to monitor thyroid functioning due to the really negative impact it could have on that gland. Also, radiation treatment can damage the thyroid, as well as steroids. So all of this can sound a bit complicated. The good news is a simple blood test can be very effective to see where the level of thyroid functioning is at that time. Alrighty, these cute little feet are a reminder that orthopedics is something we need to keep in mind. And I'm going to start by saying, again, like I did before, we have individuals who don't communicate very well. And in addition, their pain threshold may vary. We may see someone who overreacts to a small bump and someone who may underreact to an actual fracture. I recall how when I did inpatient care in emergency medicine, I would be called to a situation I was taught, make sure there's no acute danger, but then stop, catch your breath, and before reacting, get a good history. And that's incredibly important in this population. Did anybody observe a fall? What did they see? What actually happened? Then this information can help us figure out what occurred and plan accordingly. And obviously, we have to err on the side of safety and thorough evaluation, as many of these individuals may be more hurt than it appears, and we don't want to miss something more ominous. Now, I wanted to bring up muscle contractures because that's very common. This is a shortening and spasming of tight muscles. It's very common in CP. Physical therapy and the use of braces are meant to help this. And this leads to the next comment, which is about the braces. Are they new? Are they fitting properly? Is it causing pain in that area? We need to take a look at that and investigate that. Now, it's not just the muscles we have to think about, also the joints. Are they experiencing any joint pain? Is it reddened? Is it tender? Is the person not moving like they normally do? Is it hot to the touch? Is it a sign of perhaps an arthritis or infection? Medication also plays a big role orthopedically. One of the more common side effects of antipsychotic medications is acute dystonia. This means the muscles get very tight and stiff. And if you were listening, that sounds like a contracture, and it is. It's very, very uncomfortable. Also, medication can cause tics, or the person could just have that on their own. People tend to think of tics as blinking and small twitches. They can actually be the large muscle group in the body that contracts, and that's super painful. I've had quite a few people in my practice with shoulder and lower back pain from tic-like spasms that was simply a part of their Tourette syndrome or came on because of medication side effects. And lastly, don't forget the toes. Did the person hurt their toes? They can have an infection from an ingrown toenail. They can have diabetes, which leads to infections starting in their toes and moving up their feet. Something as simple as sharp nails can be really uncomfortable and lead to the person being grouchy, irritable, and maybe angry and lashing out at others aggressively. It sounds silly, but it's the perfect example of head-to-toe thinking. If someone is not acting themselves, it could be a major medical ailment down to the little toe on their foot. But we really have to take this review of systems into play when we're presented with behavioral health symptoms.
Great. So a lot of important information was reviewed during the training. In addition to our hope that it provides you a framework in order to better assess for and support medical conditions in the individuals that we all support, I also hope that it provides you the understanding as to why it's so important to really investigate the medical and biological side of things before jumping to the psychological or social. Really clearing up these ailments first is a really important method in order to support the individuals. And like both Andy and I commented at various points, the individual's communication on their ailments and what they're feeling might be impacted by their disabilities. So it's really our job as their supporters to really ensure that everything is being investigated appropriately and they're getting the proper support. If any questions came up during the viewing of this training, please feel free to reach out to me at the email on the slide, and I will be happy to answer it or connect you with Dr. Kent to get the answer that you require. Thank you so much for viewing.